Hello friends, welcome back to Multi-Question World. Today we are going to discuss some important MCQs for MOH, DHA, HAAD, Prometric exams. We have discussed a lot of questions. You can watch the previous videos from playlist. If you are watching without subscribing, please do subscribe. Question number 1. Which of the following is a common role of a clinical laboratory technologist? Option A. Performing surgery. Option B. Analyzing blood samples. Option C. Writing prescriptions. Option D. Conducting physical examinations. The correct answer is option B. Analyzing blood samples. Common role of a clinical laboratory technologist is analyzing blood samples. Question number 2. Which laboratory subspecialty focuses on the study of blood and blood-related disorders? Option A. Microbiology. Option B. Hematology. Option C. Histopathology. Option D. Clinical chemistry. The laboratory subspecialty which deals with blood and blood-related disorders. The correct answer is option B. Hematology. Question number 3. What is the purpose of a quality control in a clinical laboratory? Option A. Reducing cost. Option B. Ensuring patient comfort. Option C. Maintaining accuracy and precision of test results. Option D. Increasing the volume of tests conducted. Which among the following is a purpose of quality control in a clinical laboratory? The correct answer is option C. Maintaining accuracy and precision of test results. Question number 4. What is the minimum educational requirement to become a clinical laboratory technologist? Option A. High school diploma. Option B. Associate degree. Option C. Bachelor's degree. Option D. Master's degree. The minimum educational requirement to become a clinical laboratory technologist. The correct answer is option C. Bachelor's degree. Bachelor's degree is needed to become a clinical laboratory technologist. Question number 5. Which of the following is not typically performed in a clinical laboratory? Option A. Blood typing. Option B. Electrocardiography. Option C. Urine analysis. Option D. Culture and sensitivity testing. Which of the following is not typically performed in a clinical laboratory? The correct answer is option B. ECG or electrocardiography. Question number 6. How do clinical laboratory technologists ensure the accuracy of the test results? Option A. By using outdated equipment. Option B. By skipping quality control measures. Option C. By regularly calibrating equipment and following standardized procedures. Option D. By increasing testing volume. How do a clinical laboratory technologist ensure the accuracy of the test results? The correct answer is option C. By regularly calibrating equipment and following standardized procedures. Question number 7. What technology has significantly improved the efficiency of the clinical laboratories in recent years? Option A. Microscope. Option B. Fax machines. Option C. Artificial intelligence or AI. Option D. Paper-based records. The correct answer is option C. Artificial intelligence. In recent years, artificial intelligence improved the efficiency of clinical laboratories. Question number 8. What is the primary function of a clinical laboratory in ensuring blood transfusion safety? Option A. Ordering the blood supply. Option B. Cross-matching blood types. Option C. Prescribing blood transfusions. Option D. Monitoring patient vital signs. The correct answer is option B. Cross-matching blood types. The primary function of a clinical laboratory in ensuring blood transfusion safety is cross-matching blood types. Question number 9. What role do clinical laboratories play in tracking disease outbreaks and public health? Option A. They administer vaccines. Option B. They conduct surgery. Option C. They diagnose diseases. Option D. They provide data for epidemiological research. The role of a clinical laboratory in tracking disease outbreaks is option D. They provide data for epidemiological research. The correct answer is option D. Question number 10. Which type of laboratory technician is responsible for the analysis of microorganisms and infectious agents in clinical samples? Option A, hematologist. Option B, histotechnologist. Option C, microbiologist. Option D, cytotechnologist. The correct answer is option C, microbiologist. The laboratory technician who is responsible for the analysis of microorganisms and infectious agents in clinical samples is microbiologist. Question number 11. What is the primary responsibility of a cytotechnologist? Option A, analyzing blood samples. Option B, conducting urine analysis. Option C, examining tissue specimens for signs of cancer. Option D, running PCR tests. The correct answer is option C, examining tissue specimens for signs of cancer. The primary responsibility of a cytotechnologist is examining tissue specimens for signs of cancer. Question number 12. In a clinical laboratory, what does the term serology refers to? Option A, study of blood disorders. Option B, study of blood serum. Option C, study of tissue samples. Option D, study of genetic material. The correct answer is option B, study of blood serum. The term serology refers to study of blood serum. Question number 13. What is the primary goal of a clinical laboratory accreditation? Option A, increasing patient wait times. Option B, reducing laboratory efficiency. Option C, ensuring quality and accuracy of testing. Option D, expanding the range of tests offered. The correct answer is option C, ensuring quality and accuracy of testing. The primary goal of a clinical laboratory accreditation is ensuring quality and accuracy of testing. Question number 14. What is the role of a phlebotomist in a clinical laboratory? Option A, performing surgical procedures. Option B, analyzing tissue samples. Option C, drawing blood from patients. Option D, conducting urine analysis. The correct answer is option C, drawing blood from patients. The role of a phlebotomist in a clinical laboratory is drawing blood from patients. Question number 15. Which laboratory test measures the level of glucose in a patient's blood over an extended period, typically 2 to 3 months? Option A, fasting blood sugar test. Option B, random blood sugar test. Option C, hemoglobin A1c test or HbA1c. Option D, oral glucose tolerance or GTT. The correct answer is option C, hemoglobin A1 test, that means HbA1c. Question number 16. What is the primary function of a clinical chemistry technologist? Option A, analyzing blood for abnormal cells. Option B, analyzing blood for chemical components. Option C, conducting genetic testing. Option D, performing surgery. The correct answer is option B, analyzing blood for chemical components. The primary function of a clinical chemistry technologist is analyzing blood for chemical components. Question number 17. Which type of laboratory technology specializes in the preparation and examination of tissue samples for diagnostic purposes? Option A, histotechnologist. Option B, microbiologist. Option C, hematologist. Option D, phlebotomist. The correct answer is option A, histotechnologist. The laboratory technology specializes in the preparation and examination of tissue samples is histotechnologist. Question number 18. What does the term hemostasis refers in a clinical laboratory? Option A, study of blood disorders. Option B, the process of blood clotting. Option C, the analysis of urine samples. Option D, the measurement of blood glucose levels. The correct answer is option B, the process of blood clotting. Hemostasis refers to the process of blood clotting. Question number 19. In a clinical laboratory, what does the term immunohistochemistry involve? Option A, studying the immune system. Option B, analyzing the chemical composition of blood. Option C, detecting specific proteins in tissue samples. Option D, identifying microorganisms in cultures. The correct answer is option C, detecting specific proteins in tissue samples. Immunohistochemistry involves detecting specific proteins in tissue samples. Question number 20. Which laboratory test measures the number and types of blood cells in a given volume of blood? Option A, coagulation test. Option B, electrolyte panel. Option C, complete blood count. Option D, Western blot analysis. The correct answer is option C, complete blood count. The laboratory test which measures the number and types of blood cells in given volume of blood is CBC or complete blood count. Question number 21. What is the primary function of a clinical laboratory in blood banking? Option A, diagnosing infectious diseases. Option B, monitoring glucose levels. Option C, ensuring blood transfusion safety. Option D, analyzing urine samples. The correct answer is option C, ensuring blood transfusion safety. The primary function of a clinical laboratory in blood banking is to ensure blood transfusion safety. Question number 22. Which of the following is a critical component of a clinical laboratory information management? Option A, performing surgeries. Option B, managing patient billing. Option C, storing and retrieving test results and patient data. Option D, ordering medical supplies. The correct answer is option C, storing and retrieving test results and patient data. The following is a critical component of a clinical laboratory information management. Question number 23. What is the primary purpose of an autopsy technician in a clinical laboratory setting? Option A, administering vaccines. Option B, conducting genetic testing. Option C, performing autopsies and post-mortem examinations. Option D, analyzing tissue samples. The correct answer is option C, performing autopsies and post-mortem examinations. The primary purpose of an autopsy technician is performing autopsies and post-mortem examination. Question number 24. Which laboratory test measures the level of certain drugs, medications or substances in a patient's blood? Option A, electrolyte panel. Option B, toxicology screen. Option C, complete blood count. Option D, microbiological culture. The correct answer is option B, toxicology screen. The laboratory test measures the level of certain drugs, medications and substances in a patient's blood is toxicology screen. Question number 25. What role do clinical laboratories play in supporting clinical research and drug development? Option A, administering medications to patients. Option B, conducting surgical procedures. Option C, analyzing the safety of clinical trials. Option D, testing and analyzing samples for research purposes. The correct answer is option D, testing and analyzing samples for research purposes. Question number 26. Which of the following is not typically considered as a pre-analytical factor in clinical laboratory testing? Option A, patient identification. Option B, sample collection and handling. Option C, analyzing test results. Option D, sample transportation, which is not considered as a pre-analytical procedure. The correct answer is option C, analyzing test results. Analyzing test results is not considered as a pre-analytical factor. Today we are winding up. You can watch the previous videos from playlist. If you are watching without subscribing, please do subscribe. Thank you.